everyone, and good morning, all PhysioTV viewers. Today we have Dr. Aditi Beri, ma'am, with us, and she is a assistant professor in DS Brijla Jindal College of Physiotherapy and has a publication in various national and international journals. So, without any delay, we'll start with the session, ma'am. I'll share the screen.
So breathing exercises have also been proven to be very useful in terms of metabolic syndrome. So breathing exercise, basically it activates the parasympathetic system, and it reduces the level of sympathetic system. So this in turn will help to reduce the heart rate, blood pressure, and it helps to improve the heart rate variability. So it promotes ANS balance, which is the imbalance which is usually seen in metabolic syndrome. So breathing exercise to some extent will help in promoting this ANS balance. So as we discussed, breathing exercise will also help to reduce the cortisol level, which is seen, the stress levels increases, the cortisol level increases in metabolic syndrome. So breathing exercises are known to reduce the cortisol levels and thereby reducing the stress. So enhanced oxygenation increases the mitochondrial efficiency in muscles and thereby reducing the oxidative stress. So it is also known to improve the insulin sensitivity and glucose control. Next, breathing exercises also induces vasodilation and vascular resistance, thereby lowering the BP. It also helps in reducing the inflammatory markers, and it also promotes the anti-inflammatory pathways which are linked to vagal activation. And breathing exercises contribute even modestly towards better lipid metabolism by improving the autonomic control and stress regulation. So we'll just have a look at all of these factors at a glance. So effect of aerobic training, it decreases the visceral fat, increases the insulin sensitivity. So that causes a decrease in blood pressure, triglycerides level and the glucose levels. There is decreased inflammation, which will help to improve the metabolic health profile. Resistance exercises, on the other hand, will help to increase the muscle mass. It will increase the insulin sensitivity. It will decrease the fat and the inflammation. So there will be better lipid, glucose metabolism and blood pressure control, thereby improving the metabolic profile. Breathing exercises will help to reduce the stress and sympathetic activity. So it will bring about a decrease in cortisol levels and the blood pressure levels. Insulin sensitivity is also known to improve with regular breathing exercises, and thereby it will help to improve the metabolic profile. So as we can see, aerobic training, resistance training and breathing exercise have different pathways, but overall all of these will contribute in improving the metabolic health profile. So these were the effects of exercise, or why exercise is important in metabolic syndrome. So now let's look at some special considerations for exercise testing in metabolic syndrome. So before you go in for exercise testing in an individual with metabolic syndrome, it is necessary to perform a pre-exercise assessment. So a thorough medical history, which will include CVD risk factors, diabetes, medications if any, physical examination considering all the vital assessment. So lab test if necessary. So glucose, lipids, electrolytes if indicated. So risk stratification is a very important component. So if the patient is falling under low risk, then you might proceed with the standard testing protocols. If the patient is falling under moderate or high risk, then we might require physician clearance or proper ECG monitoring during the exercise testing. So selection of test again is important. So if we are planning to take the cardiovascular fitness, so either treadmill or cycle ergometer, modified or ramp protocols might be necessary if the individual is highly obese or unfit. 6-minute walk test, step test, sit to stand test or submaximal test also can be performed. Strength assessment, we can go in for estimation of 1 RM or even 10 RM if indicated. Next slide. So there are few safety considerations that need to be followed when we are testing the individual with metabolic syndrome. Continuous HR and BP monitoring is necessary. It is very necessary that we watch in for hypoglycemia or hyperglycemia, and the glucose checking has to be done. So account for any medication effects if the patient is on medications. So support, so orthopedic modifications again might be required again if the individual is obese or has orthopedic limitations, and ensure that hydration and environmental control is optimal. So test execution again start at low levels and then progress to moderate intensity. Gradual increments is necessary. Monitor of you have to monitor RPE, HR, BP, and also for look out for the symptoms. Immediate cessation if the adverse signs occur, or the termination criteria. Any of the criteria in termination standard is met, then you'll have to terminate the test. Post exercise or post test, it is again necessary for a proper cool down period. In the post test period also, monitoring is essential for hypertension, hypoglycemia, or dizziness if the person experiences, and record the subjective exertion and symptoms. So this was all again regarding the exercise testing. So special consideration in exercise testing. Now let's look at special consideration in exercise prescription for individuals with metabolic syndrome. So medical clearance and screening is essential before we go ahead with the exercise program. So cardiovascular risk assessment. So patients often have hypertension, dyslipidemia, or impaired glucose tolerance. So pre-exercise screening is mandatory. So you can go in for PARQ or such related questionnaires to test if the patient, for the patient to undergo risk stratification. Comorbidities, check for diabetes, obesity related orthopedic issues, and cardiovascular diseases. And patient will be on antihypertensives or glucose lowering agent. So we need to understand the effects of these drugs on exercise and monitor our session or place our session accordingly. So along with these factors, next slide please. It is essential to also record the physical activity of the patient correctly. Next slide please. So there are many subjective and objective methods for the physical activity assessment. Subjective methods include diaries, logs of physical activity, or there are many self-reported questionnaires like GPAC and IPAC that can be used. Or if objective methods are feasible like pedometers, accelerometers, they can be used. But physical activity history of the individual should be taken in detail before going ahead with the exercise prescription. So it is essential again to monitor the blood pressure and glucose level of the patient, especially in diabetics patients, because there are chances of hypoglycemia or even hyperglycemia to occur along with exercise. So avoid high impact activities if obese or joint issues are present, because there is risk of musculoskeletal injuries. It is very important that we go in for a good warm up and cool down period to prevent any cardiac event. So a good warm up period of 5 to 10 minutes, and again a 5 to 10 minutes of cool down period will ensure that we are increasing the vitals gradually, and we are also getting them back to the normal gradually. So that has to be ensured. And foot care, again, as we talk about foot care in diabetics, this is also important in the people with metabolic syndrome in order to prevent ulcers. Next slide. So exercise prescription for aerobic exercise, again going by the FITT principle, frequency of 3 to 5 times a week, with intensity of 40 to 60 percentage of heart rate reserve for moderate intensity. If we are planning for vigorous intensity, 50 to 75 percentage of the heart rate reserve. So ideal sessions should, maybe initially we can place it for 30 minutes and then gradually increase it to about 60 minutes with adequate warm up and cool down. Type of training can be continuous, interval, circuit, or circuit interval depending on the physical activity level of the individual. So these are in accordance with ACSM and also AHA. So resistance exercise, the frequency of resistance exercises would be 2 to 3 times a week. Intensity would be some percentage, again depending on the health status of an individual. So some percentage, so say 50% or 40 percentage of either 1 RM or 10 RM to begin with. Repetitions would be 10 repetitions, 1 to 2 sets, and then we can progress gradually. So type of resistance exercises could be using the body weight as resistance. So squats, push-ups can be given, or free weights, dumbbells, and TheraBand based exercises. So when we are prescribing exercise program to these individuals, it is necessary to strictly follow the principles of exercise training. So principle of overload, principle of specificity, reversibility, and it is very essential to have custom made or tailor made programs for these individuals, because the limitations will be different for in each individual. So we need to analyze their metabolic profile. We need to analyze which factors are they qualifying for metabolic syndrome, and then gradually, then assign a proper individualized specific exercise program for that individual. So intensity parameters, there are various parameters that we can use to determine our intensity. So we can have it in terms of some percentage of HR max, or VO2 max or heart rate reserve given by Carbonen's formula. So HRR is the heart rate at rest plus 60 to 70 percentage of HR max minus HRS. So we can start with 40 to 50% and then progress accordingly. If these factors are, if these values are not available, we can also go in for RPE, especially when we are giving home program to the patient. RPE will be an important tool to prescribe our intensity, or we can also grade our intensity based on metabolic equivalent or talk test. So RPE and talk test will be feasible if you're prescribing home-based exercise program. If we are monitoring or we are going in for supervised exercise program, heart rate reserve will be an better option. So let's look at some MET values of common physical activities. Next slide. Of common physical activities and their classification. Next slide. So light intensity activities or the activities that classify to less than 3 minutes include slow walking or household chores and occupations like making bed, washing dishes, ironing, preparing food, etc. or desk job again. So most of the sedentary individuals are involved in desk job, which falls under light category of MET. So leisure and sports, it might include playing cards. So basically all the sports that we play indoors or in sitting position, most of the musical instruments, billiards and darts. Next slide. So moderate intensity activities according to the METs include brisk walking, heavy or deep cleaning, sweeping, mopping as far as the household chores are concerned. And leisure based sports will include swimming, badminton, table tennis and volleyball. Next slide. Vigorous activities will include jogging and running or hiking. It can also include heavy farming, carrying heavy loads, shoveling and digging ditches as far as occupation is concerned. And tennis, singles, soccer and basketball will classify under vigorous recreational related activities. This is just to give you an example of how the intensity will vary and how can we include this intensity while prescribing our exercise programs. Next slide. So as we have discussed earlier, breathing exercises also play a very important role in management of metabolic syndrome. So we can go in for diaphragmatic exercises, slow and controlled breathing exercises. Pranayam has also been proved to be very useful in improving the metabolic profile. Flexibility exercises again plays a very important role. So our cool down phase of our exercise program should include some flexibility exercises. So it can include some stretching postures, static and dynamic exercises, stretching exercises or yoga postures. Next slide. So the physical activity recommendations given by ACSM, CDC or AHA. So there should be 150. So you can start with 150 and progress gradually to 300 minutes of physical activity per week. So it roughly comes down to 30 minutes of exercise daily, and then you need to progress it to around 60 minutes of physical activity per day. So individuals who have severe comorbidities and they cannot really go in for 30 minutes program per day, they can go in for 10 minutes of bouts of exercise physical activity daily, but it should at least count out to 30 in a day, and the bouts should be of at least 10 minutes, not less than that. Resistance exercise training is should be prescribed for at least 2 to 3 days per week, and combination of aerobic and resistance training works the best. So there are few studies which have analyzed the barriers to exercise in metabolic syndrome. So these are some of the factors. So there is lack of motivation, physical limitations because of obesity, arthritis or MSK related impairments. There are also certain misconceptions that have been identified. So only medicines will work or only diet will work. So not many have understood the importance of exercise in metabolic syndrome. And there are also some socioeconomic and cultural challenges to participation in regular exercise program. So these factors again will not be dealt with in a day. So it will require proper counseling, group programs and supervised sessions in order to develop interest of the individual in exercise program and to make them understand the importance of exercise as a major lifestyle modification strategy. So now next slide, let's look at some simple and practical tips that will help to improve physical activity in individuals with metabolic syndrome. So we can advocate them to start small and build gradually. So it is always better to start at low intensity and start with small activities and then build up gradually. Choose enjoyable activities. So initially let them start with any physical activity that they enjoy or that they like, and then we can progress gradually. So if regular physical activity is again not possible, they can go in for simple exercises or simple strategies that will help to break the sedentary time. So maybe go up with steps, ditch the lift or car parking. So park as far as possible. So that will also involve some amount of walk. And also whenever you're using your mobile phone for meetings or for talking, you can advise them to walk when they talk. So automatically it will increase the physical activity and the walking time, thereby reducing the sedentary time. So incorporate some form of aerobic and strength training in your routine. Set realistic goals. This is again very, very important. Make it social. So you can ask them to participate in group exercises, which will also help to improve the motivation and accountability. So use everyday opportunities. So cycle, you can use cycle for some running, for some short errands or household chores. So try and think of all the little changes that you can make in your daily household chores and your daily routine, whereby you can incorporate some amount of physical activity. So focus on non-exercise activities, so which will include conducting meeting with the help of standing desks, stretching breaks or light walk breaks in your office timings. Prioritize safety. So as I told you, good warm up and good cool down is very essential in individuals with metabolic syndrome. So reward and reinforce. So celebrate milestones to boost motivation, and thereby we can build up gradually. Next slide. Yeah, 1 second. So as we have seen, exercises improves all the components of metabolic syndrome, or it has an impact on every single factor of metabolic syndrome. So it enhances insulin sensitivity, it improves the insulin resistance, it decreases the insulin resistance, it increases the insulin sensitivity, it increases the insulin receptor signaling, thereby lowering the fasting blood glucose level. It improves endothelial function, it reduces arterial stiffness, thereby reducing the resting BP. It also provides holistic health benefits. It improves mood. It reduces depression and anxiety. So it has been shown to improve the quality of life, and it also prevents the progression of diseases. So not just one factor, it has an effect on almost every single factor contributing to metabolic syndrome. Next slide. So exercise thus acts as a powerful, cost-effective cornerstone therapy that will help to unlock health by targeting all the components as well as the risk factors for metabolic syndrome simultaneously. So regular physical activity can prevent, manage, and even reverse metabolic syndrome components. So medication will help to control, but exercise will surely help to transform. So I hope I have done justice to the title of the topic and this session was useful. These are the references. Thank you for giving me this opportunity.
Yes, ma'am. It is a very informative session. Before going ahead, I would like to ask you one question. As you said, in a diabetic patients, they have a risk of having hyperglycemia or hypoglycemia while doing exercises. So what should we do when this situation happens while doing exercises?
Correct. So you need to place your exercise sessions according with the medication or that the patient is on. Say correct. So chances of hypoglycemia are more when you have peak action of insulin and at the same time you are giving exercise program. So you need to understand the medication that the patient is on and time your session accordingly. So at least the chances of hypoglycemia will be prevented. And hyperglycemia per se, patients with metabolic syndrome have a state of hyperglycemia. That is when regular aerobic exercises and resistance exercises will help to reduce that state of hyperglycemia.
Okay, okay. Thank you, ma'am. And thank you so much for this session. This was a very informative session. And I would like to take the opportunity to thank Dr. Parag Sancheti sir, Miss Manisha Sangvi ma'am, Dr. Ashok Sham sir, and technical team of Physio TV. Thank you so much.
Thank you. Next slide. So regular exercise will promote angiogenesis and it will help to improve the arterial compliance, thereby reducing the risk of atherosclerosis and CV complications. So by improving the arterial compliance, it is also helping to reduce the risk of hypertension. And exercise, as we all know, exercise increases the lean muscle mass and it reduces the total body fat, thereby improving the basal metabolic rate and overall metabolic health. So body composition and weight control will also help with the help of regular exercise. So in addition to all of these effects, there are some separate or exclusive effects of aerobic exercise and resistance exercise. So aerobic exercise will also help to improve the cardiovascular fitness. It will also help to improve VO2 max and cardiac output. It also increases exercise tolerance and overall functional capacity. There is also mental and hormonal benefits that can be seen. It helps to reduce the cortisol and adrenaline level, thereby reducing the stress levels. And it also promotes release of happy hormones, which will promote enhanced mood. So resistance exercise, on the other hand, will help to enhance the muscular strength and muscle function. So it will support better glucose metabolism even at rest due to active muscle tissue. So the basal metabolic rate will also go up. It will also help to promote the hormonal balance. It increases the testosterone, growth hormone, and IGF-1 levels, which will support the metabolism and lean body mass. It is also seen to reduce the cortisol levels, which is associated with stress and the fat storage.